Are you feeling depressed? Are you feeling panicked? Are you stressed out? Premenstrual?
Then maybe you should talk to your doctor about prescribing Zoloft. Zoloft is an antidepressant belonging to a group of drugs called selective serotonin reuptake inhibitors. Zoloft is used to treat depression, obsessive-compulsive disorder, panic disorder, anxiety disorders, post-traumatic stress disorder, and premenstrual dysmorphic disorder. Do not use Zoloft if you have used an MAOI in the past 14 days. Take Zoloft exactly as prescribed by your doctor. Follow all directions on your prescription label. Zoloft may be taken with or without food. Try to take the medication at the same time each day. Do not stop using Zoloft suddenly, or you could have unpleasant withdrawal symptoms.
Get back on the horse with Zoloft, used in the treatment of moderate to severe depression. Warning! Antidepressants increase the risk of suicidal thinking and behavior in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders in short-term studies. Short-term studies did not show an increase in the risk of suicidality with antidepressants compared with placebo in adults older than 24 years of age. And there was a reduction in risk with antidepressants compared with placebo in adults aged 65 or older. The risk must be balanced with the clinical need. Monitor patients closely for clinical worsening, suicidality, unusual changes in behavior. Also, families and caregivers should be advised to the need for close observation and communication with the prescriber. Sertraline hydrochloride is not approved for use in pediatric patients except for patients with obsessive-compulsive disorder.
The generic name for Zoloft is sertraline, pregnancy category B. Adverse reactions of Zoloft are frequent headache, nausea, diarrhea, insomnia, somnolence, dizziness, fatigue, rash, and dry mouth. Occasional anxiety, nervousness, agitation, tremor, dyspepsia, diaphoresis, vomiting, constipation, abnormal ejaculation, visual disturbances, altered taste. Rare flatulence, urinary frequency, paresthesia, hot flashes, chills. Drug interactions: increased CNS depression, alcohol, St. John's wort, increased side effects, highly protein-bound drugs, aspirin, tricyclic antidepressants, increased half-life of diazepam, possible inhibition of sertraline metabolism, erythromycin, clarithromycin, potent inhibitor of CYP2D6 isoenzymes, use drugs metabolized by the enzyme only with caution. Possible risk of serotonin syndrome with tramadol, oxycodone, decreased effects, carbamazepine, NSAIDs, increased risk of GI side effects.